I hope you're having a great day. I hope you had a great peaceful weekend and you're staying safe at home. Well, today I want to talk about low blood pressure. We always talk about high blood pressure. We talk about all of these issues, but hypotension or low blood pressure is also a serious problem, and a lot of people suffer from this. What are some of the common symptoms that we identify in people who have low BP? It could be extreme fatigue, extreme tiredness, and sometimes we confuse these symptoms and we start eating more sugar and more carbs, thinking that our energy levels are low, but it could be hypotension, it could be fatigue, it could be a dizzy spell. Sometimes you may faint. You don't always have to faint. You may feel slightly dizzy, you may have to sit down, or you may just suddenly blank out. Then you have cold sweats, clammy hands. Your hands may get clammy, shallow and rapid breathing. These are some of the most common symptoms that someone with hypotension can have. Again, okay, you always make an informed decision, because these same symptoms can be caused also by something else. It could be by high blood sugar levels or also low blood sugar levels. So you always want to make sure that you make an informed decision about this. Now, hypotension, this results in low blood flow, a reduced blood flow to the brain, to the heart, and to vital organs. So knowing that, it could be something pretty serious for you. Some people have nausea as well. They have this constant nausea feeling. They have a blurred vision. Their vision kind of gets blurred all the time. So these are common symptoms that you have. Are there ways to fix it? Absolutely yes. Number one, you want to keep your doctor in the loop for this. When there's high blood pressure, low blood pressure, as many remedies as I give you, or lifestyle changes, these are serious things, because if your blood pressure goes too low, it can create irreversible damage. So you want to keep your doctor in the loop. There is nothing wrong with medication. The only problem with medication is when we take it like candy and we don't change our lifestyles, when we self-medicate ourselves, we over-medicate ourselves, or we take medicine with the belief that it's going to cure all of our problems and we don't make those lifestyle changes. We have something called postural hypotension, which is something that a lot of people suffer with. Whenever you lie down, you get out of your bed all of a sudden, or in the morning you wake up, you sit up and stand up, and all of a sudden you feel dizzy, or you almost collapse, or you also faint. There's an immediate drop, and this is called postural hypotension. And people with this, they can follow the remedies that I'm about to give you and lifestyle changes, but you have to get up really slowly. You can't just get up and jump out of bed, because it's creating a complete drop in your blood pressure. So you got to probably sit up, take a couple of deep breaths, put your feet on the ground, and then slowly stand up. Don't walk, stand for a couple of seconds or maybe a minute, breathe, and then you notice that you feel okay and you can get back to your daily activities. That's called postural hypotension, and you got to take care of it. So what are some of the simplest natural remedies that we have right now that you can take care of this? Number one is eat frequently. A lot of people keep long gaps between their meals. I'm not talking about fasting. I'm talking about long gaps. They're supposed to eat lunch, but they take on a meeting or they have some phone calls and they delay their lunch. They can have a drop in their blood pressure immediately. So if you have constant low blood pressure, you want to make sure that you're eating frequently. Maybe every 3.5 hours. Some people even have to eat every 2 hours. It's different for everyone. Everyone's unique. So what I'm telling you, try it. Works for you. You figure out the frequency of your meals and your snacks. Salt. Today, a lot of people, to lose weight, go on these no salt diets, and that's one of the most stupid things that you can do, because salt is required. Sodium chloride is an electrolyte that is required for the functioning of every cell in the organ, your vital organs, and your brain. You know, a lot of people take fad diets thinking they lose weight, but they just don't want to put in effort, discipline, and consistency. So they do stupid things that destroy their health. They do oil-free cooking, salt-free cooking. They lose a little bit of weight and then they look way older than they should, and they have other deficiencies. You must have the right quantity of salt. You can have a combination of pink salt and white salt. If you're a thyroid patient, if you have goiter, you need iodine, you may have to use iodized salt at the same time. So speak to your professionals around that. But when you have low blood pressure, mixing a little bit of pink salt and a little bit of white salt in a glass of water. You can add a teaspoon of jaggery and sprinkle a little bit of fresh lemon. You can make a liter of this and sip on it throughout the day. And this can maintain your blood pressure in case you have hypotension. So a little bit of pink white salt, a little bit of jaggery, and a little bit of lemon. Tulsi. Chewing on tulsi leaves is something traditional to our country. If you can't get those leaves and you can't chew on them, you get tulsi drops. This is easily available. Get a good brand. You can take 4 to 5 of these drops in water, especially when you have a drop in your blood pressure, and that will help you with your hypotension. Now, coffee Caffeine will give you immediate relief. It's not a solution, but if your blood pressure has gone really, really low, a nice cup of black coffee or maybe milk coffee can help you get that up temporarily. It is not a solution. This is just a quick fix, a band-aid method. Now, almonds and almond milk. This is an age-old recipe where you take about 4 to 5 almonds, you soak them overnight in water, and in the morning you blend them in the mixer, and you have almond milk. This can also help you with hypotension. But one of the best remedies that has worked for all of our patients worldwide, in India we get the brown raisins. They're called munakas. These are not the black raisins, they're not the small green raisins. They're large brown raisins. They're not really golden, but they're large and brown. You can Google these, they're easily available in our country. They're very different from kishmish. These are the large brown raisins. You can soak them overnight and have maybe half a handful or a handful in the morning. Now, if the patient with hypotension also has anemia and low iron and low hemoglobin levels, you can take about 5 or 8 of these raisins and boil it in ethically sourced milk and consume this before bedtime. It will help you with your hemoglobin levels and will also help you with your blood pressure. Now remember, these munakas and these raisins, they would be bad for diabetics because the GI is very, very high. It may spike up your blood sugar levels. So if you're diabetic, you want to make an informed decision. It doesn't mean you can't have it. But if you plan it well into your diet, you should be able to have it without a problem. Now, deficiencies for hypotension: low B12, low vitamin D3 and iron levels. So you want to be in clue on these levels. If you have low B12, get it fixed. You have low folic acid, get it fixed. You have low D3 and low iron levels, you want to get it fixed because this can contribute to hypotension as well. When you have hypotension, you want to stay off the alcohol for a while. You do not want to consume alcohol because that will increase your low blood sugar. You want to check your thyroid gland. If you suddenly, all of a sudden, develop hypotension symptoms, you want to do your TSH test, your T3, your T4, your ATG, and your anti-TPO tests. Because sometimes with a thyroid problem, or if you're developing a thyroid problem, one of the symptoms is hypotension. And of course, your blood sugar levels. If you're diabetic and you have high blood sugar levels which are uncontrolled, it can also lead to low blood pressure. High